Without further ado, let me welcome to the stage Supervisor Nathan Fletcher, the chair of the San Diego County Board of Supervisors. Let's bring him on up. Welcome, sir.
Good afternoon.
Appreciate you being here. Give us a rundown. Tell us what you're spending your mental energy on when it comes to healthcare. We'll get into the weeds, but just take it away.
Well, I mean, I think, one, it's wonderful to see everyone. I don't know about anyone else. I'm so over Zoom. I don't know if it's the extrovert in me, but I just can't handle sitting in my room doing one Zoom after another. So it's just wonderful to be here. If I don't say anything substantive or interesting afterwards, no, I appreciated being in your company. Look, it's a really tough time right now in our country, across the board, and there's Dr. McDonald and I were just talking about this. We're kind of in this COVID hangover phase. It's still here. We're still dealing with it, but we got a lot of societal challenges and issues going on, and we see that manifest in ways. What is the probability of county supervisors who, prior to COVID, most people in San Diego didn't even know existed, being on the receiving end of multiple death threats multiple times a week, multiple times, and it's a really toxic and difficult period. And so I think at some part, we've got to really figure out how as a society, outside of just talking about healthcare, and then we'll pivot back to healthcare, how do we return to a place where it's okay to disagree? How do we return to a place where it's okay to passionately disagree without having to resort to so much of what we're seeing at public meetings and across the board today? And I've been thinking a lot about that. I think I suffer from what I call the rationalist delusion. It's an actual diagnosable thing where, I don't understand, why would you say that? That's objectively false. That's not true. Why would you advocate a position that only is going to kill you? Why would you do all these types of things? And I'm reminded of a conversation I had a number of years ago when I was working at Qualcomm. Don Rosenberg was the general counsel, a wonderful man. And he asked me he said, will you go to this lunch with me? And I'm like, well, you're my boss. I'll do whatever you tell me. But he goes, it's with the Supreme Court justice. I said, oh, that's great. And he said, well, I didn't say which one. I'm like, I'd go to lunch with any of them. They're all interesting people. But it was with Ruth Bader Ginsburg, and I thought it would be hundreds of us listening to her. And when I got to the lunch, there was 8 seats around the table. And it was just 7 of us and her. And I actually sat by her. And my question to her, and this I think it's the state of the world, and then we'll go to the state of healthcare. But I said, when you were nominated to be a Supreme Court justice, Ruth Bader Ginsburg had been the general counsel for the ACLU. She was an unabashed liberal. Everyone knew her position on all the hot button issues. She didn't hide from them. She was very upfront about them. She couldn't be nominated today. The most progressive, Barack Obama nominated Merrick Garland, who's probably a Republican, and he couldn't even get a hearing. The notion of nominating someone who'd been the general counsel for the ACLU. And in a Republican-controlled Senate, Ruth Bader Ginsburg got 96 aye votes to confirm her. 96. Breyer came after her, got 97. No one's got out of the 60s. And I said, what happened? And she said the symbol of America is, she said her late husband Marty used to say, the symbol of America is not the eagle, it's the pendulum. And it swings. And it had swung to dysfunction, government shutdown, impeachment, and people just wanted stuff to work. And that was the environment in there. And my only hope is that we can start some way to start swinging back. That doesn't mean we all agree. It doesn't mean we split the differences on our agreements. It means we passionately hold beliefs. We passionately fight for beliefs. But we find a way as a society that we can have these discussions and elections and those types of things in a positive way. And so I've really been thinking about a lot on that because it just weighs on me. I want to have a board of supervisors meetings that my kids can watch. And I want my kids to watch a meeting where people come down and say that these folks think my boy's dad is wrong and I'm making a bad decision, but a way that we can do it. And so I think we've all got to find a way, and I'm guilty of this. I can fall into the trap as well of finding a way, whether we're talking about healthcare or immigration or elections, that we can revert back to a place where we do it with just a modicum of dignity. Would be a really, really wonderful thing.
Let's stick on this for a second before we spend more time on healthcare. I think that when I ask this question, the answer is always, I don't let it bother me, I do my job, but I don't think that's complete. Give us a sense of what it's like to receive death threats as an elected official where you got kids and a family. And I know you're going to say it's, but
well, and it's not, and I'm not complaining about it. I've been through, I've done this for a bit, and I've been through difficult cycles, and so it's not a desire to have sympathy. And I actually think healthy dissent is vital in any democracy. Rigorous aggressive, principle-based, ideological, philosophical values dissent is healthy. If you're having a substantive discussion and no one disagrees, you got a problem, because you're either not doing anything or there's some inherent problem. But, you know, I've got Marine buddies who I served with and fought with, and we'll get together, and they'll say, man, I love you like a brother. I love you like a brother. They're like, I'd never vote for you. I'd never vote for you, but I love you, man. And like, that's okay, right? I mean, you know, that is okay. But it's just something happened, you know, and it's part of it's the platforms, right? Part of it's how we get information. Yeah. And, you know, I'm not going to drag the platforms forever, but I am for a minute. When we hijack the psychology of America, meaning my wife and I have 5 kids, and you can watch the brain being hijacked on the like notifications, and it happens to every one of us. We're all guilty of it. You open the app and you hit notifications and you go. And so we've hijacked the psychology of Americans in that your value and worth is how many likes, retweets, shares you get. And then we channel that into what gets promoted as the most extreme content. So we take your psychology that makes you want to do this thing in an almost addictive dopamine functioning way, and then we reward it with the most extreme content, and then we wonder why we have such incredible polarization. And case in point, I had somebody one day, there was a picture of me and Joe Biden, which is a very triggering event apparently. Pretty moderate kind of guy, Joe Biden, but nonetheless. And somebody said in the comment, they said, someone should put a bullet in the head of Fletcher and Biden. Now, I'm thinking, like, that's not nice. You know, maybe we ought not say that. So I see that, and I'm like, well, the Secret Service might be interested in that, or my own folks. But I was like, you know what? Facebook will take care of this. So I hit the little button and reported it as violating the community standards. And lo and behold, the next day I get a notice from Facebook, and they said, we reviewed the comment, and we determined it doesn't violate our community standards. It said someone should put a bullet in the head of Fletcher and Biden. So I take a screenshot of that comment and their response, and I do a post. And I said, Facebook is complicit in the violence environment we see today because they allow things like this to go on. You know what happened 90 minutes after I posted? They took my post down. They said my post violated their community standards. And so, like, there's a lot of things that are at play in here, but it's just a sad state that when my kids, you know, get in the car in the morning to go to school, you know, they got to get in the SUV with people with guns. Yeah. And that's not the world we want to live in. Yeah. You know, and it's not, I'm not saying any part of this is kumbaya moment, but we just got to figure out how there is still something that holds us together. We all love our kids. We all want a better future and get back. And I think that the Trump era where it was okay to lie, I mean, there used to be a societal shame in lying. The president's, you know, when Pentagon Papers came out, it was devastating because it told us people lied to us, and that was a devastating thing. And then you get someone who would lie to you 10 times a day and make it okay. And then something triggered when we undermine the integrity of the election. In that, look, I think Donald Trump's terrible. I was a Hillary Clinton delegate. I flew to other states I campaigned for, I worked for. I think the Electoral College is a mess. I don't know how to explain to my kids who got the most votes, didn't win. But nonetheless, Donald Trump won the 2016 election. He won. I'm not disputing that. And Joe Biden won the 2020 election. And we ought not dispute that either. But when we undermine the integrity of the elections, then it creates an environment where people say, well, I can't electorally beat you because you rig it. So therefore, my only option is to, you know, come to your house and do these things. And that's the part that is different. We've always fought, we've always disagreed, we've always bickered, we've always had that. But it's at a level now that we haven't had. And that's what I just hope for the sake of our kids and our next generation, we've got to restore that piece.
Yeah. Yeah, when you believe that elections don't work, it means you take extra, or you have to take, you may think you need to.
And I've lost elections. Look, I've lost. And I go out the next day, and I'm literally like choking on my own vomit because I don't want to say it, and I congratulate the person that beat me. And it sucks. It's awful. Like, it's miserable. And I don't want to do it because I don't think it was fair, and they lied, and I didn't like this, and I didn't like that. But I go out, and I say, congratulations, you won the election. You're my representative now, and I want the best for you. You know, and I've done it, and it's awful, but you just do it because it's not. That's the nature of it, and there's some of those things, you know, that we've just got to find a way to get back to. There's still such thing as objective truth and things that you can prove.
Yeah.
So.
in a past life, you were elected as a Republican and
Uh-huh.
considered a rising star, potential statewide or federal candidate for the Republican
Yeah.
Party. In this life, you're elected as a Democrat,
Yeah.
considered, a rising star and a potential candidate for something or other
Yeah.
as Democrat. So what, as we sit here today in 2021, recognizing that some people have the courage to change their minds over
Yeah.
time, what is a Nathan Fletcher Democrat?
Well, so let me take the first one, and then I'll take the second one. The first part of this is this notion that somehow if you're in elected office, you can't change your mind. I mean, that's ridiculous. I remember listening to an interview with the member of Congress from up north who literally said, I've been in elected office 27 years and I've never changed a single position. Now that is terrifying to me. In 26 years, you didn't learn anything new. In 26 years, you didn't talk to a group you'd never talked to. You didn't get a perspective you'd never had. I mean, it's only in politics. So I was in the Marine Corps. When I was at combat, if I was a team commander, if I went and designed, hey, we're going to raid this house, we're looking for this person, we develop a plan, and we get a quarter of the way into executing that plan. And all of a sudden, I realized that everything I had believed to be true when I planned that raid was not true, or circumstances had changed. I wouldn't say, well, this is what we're going to do, because it's what we said 2 days ago we'd do. I'd go to prison for that. I would go to prison for not adjusting. And we actually give medals for battlefield decision making, which means you take into account how circumstances changed and new information, and you adjust to do the best course. In business, if you go into business and you're like, I'm going to sell this, and you take investor money, and then you realize nobody's going to buy this, you don't say, well, I'm going to bankrupt the company because no, you adjust. And it's only somehow in politics where if you get new information, you gain a new perspective, you get a new understanding, your circumstances change, and you acknowledge that reality, that somehow that's bad. And so I just think, I'll give you a healthcare example on this. I was elected to the assembly. I was the youngest member of the assembly, not in history, but at that time. And Patrick, who's here, will remember this. Patrick was working for me. We had a bill on gender discrimination in healthcare pricing. And it was to ban that process. And I had never thought about this issue in my life. I'm 30 years old, and I've got health committee, and I got 47 different things I never thought about, and I got about 3 minutes to think about it before I go out there. And the argument was, look, we charge young men less than young women because the young men use less health care. And then when you get older, it can flip, and because men are stupid, and then we get really broke when we're old because we never took care of ourselves, and then you charge us more, and you charge women less. And the argument was, if you don't let us do that, then we're going to have to raise the price on young men, and they're the most price sensitive, and this is pre-Obamacare, there was no mandate. They'll just be uninsured until they blow out their knee doing something that stupid young men do, and then the system as a whole will absorb that, and we'll have more uninsured. And I thought, okay, well, that makes sense. So I voted against the bill in committee. And then that night in Sacramento, I went for a run, and I was running, and I was thinking back through my day, and I thought about it, and I thought, but there's certain groups in our society that we know have higher healthcare costs, but you can't charge them more based on your race, because that's not a choice you made. And why would we charge you more based on your gender when the same thing, that's not a choice that you made? So when it got to the floor of the assembly, I stood up on the floor and I said, hey, in committee I voted against this bill and here's why. And then I thought about it a little bit more. And I actually think I was wrong. And I've changed my mind. And I support it, and here's why. And I think that's okay. That's an okay thing to do. And when I ran for the assembly, you got to go back 2006 now, when I announced, I was it's hard to imagine today, a Republican who supported a woman's right to choose, who supported marriage equality, who believed climate change was real, who thought immigrants should have a pathway to citizenship, who thought background checks kind of make sense if you're going to buy a gun, who believed all of those things and thought, but fiscally, more responsible. And I really thought, having grown up in a very conservative environment, at the time my belief was the Republican Party afforded you the best chance to have a life of success. You could move up through the middle class and achieve success. Then the Republican Party changed, in part. You had the rise of the Tea Party, the Trumpism, populism, nationalism that I saw coming was dragging the party one way, which was not where I was at the time. But on economic issues, so everyone who changes party says, well, I didn't change the party, change I didn't leave the party left me, and that's generally not intellectually honest. There's a little bit of that, the Republican Party left me, and there's a little bit of, I came to the realization from an economic perspective that don't take this personally if you're a Republican, it's not intended at you, but in general, that the Republican Party had become more economically about protecting people who had already made it than it was about allowing everyone access. And coming out of a working class blue collar family, growing up as a kid where neither of my parents had graduated college, I think we got to have a real conversation about economic justice and preserving the middle class and not having workers get screwed and runaway greed and misclassification and all of the other types of things. Because absent a healthy middle class, we lose the essence of the American dream. The essence of the American dream is not equality of outcome. Not everybody is going to end up with the same size house, but there's supposed to be equality of opportunity and equality of access. And when I've got a decimated middle class, there's no economic rungs to climb. When someone who works full time can't afford a place to live, when workers continue to get exploited, you're destroying the American dream. And if we destroy that, and there's no opportunity to climb, and it's not just economic justice, environmental justice. I've got a community, which you can see out your window here, that has asthma at 9 times the rate of another community you can see out of your hotel window here too. Now that ain't right. One child's not supposed to have asthma at 9 times the rate of another child because of the color of their skin or their income level. And so I believe as a Democrat, we're here to talk about preserving equality of opportunity, which means every child gets a quality education. It means children can breathe clean air. It means people have access to quality, affordable health care regardless of their immigration status or their income. It means workers get treated with value and dignity and respect and have protections from so many of the things that are ripping apart the social fabric of the middle class today. And so I'm proud to be a Democrat, and I think anyone who's gone through the party change, though, that my wife who's Catholic will tell you there's no Catholic like a convert. You know, in religion it's accepted, it almost takes a convert to be a zealot. And, you know, I'm a proud Democrat, and I believe in what our party stands for. No party's perfect, you know, I certainly get that. But it was a conversion that certainly felt comfortable for me.
Yeah, good stuff.
Yeah.
So let's dig in on healthcare a little bit.
Yeah.
Tell us about your thinking behind driving the behavioral health hubs and how you see those kind of playing out in San Diego County.
Yeah, I mean, when it comes to behavioral health, I mean, the biggest problem is that we talk about behavioral health. Well, we have to talk about it separately. It ought to just be health. I mean, but it's not. It's not, and we've never treated it as such. If every one of you sitting here right now broke your leg, all of you like instantly broke your leg right now, you'd be all right. You'd be all right. We got a system. We could get you all in. We could get you an x-ray and a cast, and we'd probably get you back here in time to go to bed at a reasonable hour because we have an incredible healthcare system in San Diego. But if every one of you right now needed mental health treatment or drug treatment, good luck. Good luck. Because we don't view it as health. Right? We don't fund it, staff it, cite it, reimburse it. We don't workforce it. We don't do it in such the same way. And a lot of that is the stigma that comes and is associated with issues of mental health illness. Look, I don't see how it's any different if you're diabetic or you're bipolar. I mean, what's the difference? You've got a chemical imbalance in your body that we can figure out how to help make better. What's the difference if you have high blood pressure or you suffer from addiction? It's the same thing. I mean, addiction, you know, you can use heroin one time, changes the dopamine composition of your brain where your choice is use an opioid or don't function, and it turns out, wow, we've got a medication that can help you block those receptors and get through life. But we have such societal shame and stigma. And so the dream is that one day behavioral health is not seen as this separate, distinct thing. It's just a part of health. Why do I take my kids to get a physical? I had to take my kids to get a wellness check. And that wellness check ought to include how are they doing up here? Not how is the composition of the skull, how is what's going on inside. And so I think we've got policies we've got to change. We've got societal stigma we have to change. You know, as a veteran, if I tell you the Marine Corps injured my hip, and I had 7 massive hip surgeries. I was inpatient in Balboa for a month. I almost died. I didn't walk for 6 months. But after those surgeries, I ran the Ironman. I climbed Denali. I can back squat 400 pounds. You would think, well, you're resilient. right? You overcame something. But if I tell you the Marine Corps also injured my brain, and I deal with post-traumatic stress, and I have difficulty sleeping, and this is what I do to make it better, there's a different feel in what that means. And that's the thing that we have to break down. And so I chose to take on tackling issues of mental health and substance abuse treatment because as a county, we have to get on the front end and the tip of the spear in changing this. And so we are moving, whether we're talking about mobile crisis response teams, about person-centered care coordination, particularly for our SMI population, whether we're talking about crisis stabilization units, about harm reduction. I mean, it's crazy that in 2021, it was still a divided vote to barely say maybe we ought to do needle exchange. I mean, needle exchange is one of the most successful programs ever at actually getting people into treatment. It works. It works. And I lost that vote the first time. I had to come back and do it a second time in order to build enough support. And we're doing a whole workforce conference on this. And so I just think we've got to break the cycle of allowing people to get to a state of crisis, having the cops pick them up, either take them to jail when they probably don't need to go to jail, take them to our psych hospital on 5150 hold, or clog up your EDs, where we do a good job of getting them well, and then we just charge them right back out into the street. We've got to flip that pyramid where we provide ongoing care, care coordination, community-based care, and we got to break down these stigmas associated with people getting help.
You got to. You know, I mean, let's face it, whether you're a Democrat or Republican, of course, we have the Assembly member, Marie Waldron, who's the Republican leader in the Assembly, coming up this afternoon. Regardless of one's party, I always like somebody who knows what they're talking about, and you do, which is fabulous. So what do you think about, you know, this healthcare community that doesn't always doesn't always engage directly with counties, because counties are carved out in their own space, and
Right.
San Diego County is unique and different and better than almost every other county in terms of engaging with the rest of the healthcare system and contracting out and procuring and all that stuff. There's this statewide Medi-Cal procurement coming.
Yeah.
What do you think about that as the chair of the
Yeah.
Board of Supervisors in terms of the county's role in working with, partnering with, collaborating, regulating, contracting with, serving, paying MCOs?
Well, I think, so let me, part of this, we have an incredible healthcare community in San Diego. As I talk to colleagues in other parts of the state, you know, we really saw it in COVID, where we had the CEOs of all of the major systems, almost all of the major systems were wonderful partners, incredible partners. We were on the phone, we were collaborating, we were working, we were coordinating, we were sharing, we were helping each other. And I think that is generally true. There's always going to be little rubs here between folks and different things, but I think in San Diego we're really fortunate and blessed to have an incredibly collaborative healthcare system and community across the board, and I think that is unique. Having said that, on the reprocurement process, there's parts of this that are incredible. The Calium stuff around in-lieu services is potentially transformative when it comes to the services that our Medi-Cal lives will be able to get. When you're talking about enhanced case management, when you start talking about housing, you start talking about all of those other things, those options of in-lieu services that's about to go into effect, I think that's potentially transformative, and I think that is one of the single best things to come about. COVID delayed it all. There was a lot of momentum and energy, but we're going to get there. And I think when we think about those Medi-Cal lives, the overarching thing has got to be, how do we help these individuals? How do we best help them? How do we genuinely care about their lives and getting them the best care? And so I think that part of it, the in-lieu services part, is one of the things I'm perhaps most excited about. The second half on the reprocurement, you know, down here in San Diego, it gets a little messy perhaps. I'm going to tell you, everyone involved in this system knows it's crazy to have 7 different plans in San Diego. You got 7 different Medi-Cal plans in one county. And every provider out there knows it's a mess. You got 7 forms, you got 7 different systems, there's not consistency in what's covered. It doesn't work, and there's a reason that 90% of the state of California is not in a system like we're in. It's only us in Sacramento that these geographic managed things that were carved out in the 90s because the board at the time didn't want to be involved in it, it doesn't work. And so the state is going to streamline it down to 2 or some number, and I'm not picking them, no one at the county's picking them, we're not picking them. But I get it, it's concerning if you're part of the 7 and it's a multi-year phase in and we're going to walk through the transition in the lives and how that go. But go look at the data on outcomes and compare the 2 plan counties and the 7 plan counties, and it will tell you that you're not getting the level of care that you ought to be able to get. And so the data tells us we get better outcomes. The providers will tell you they'll be able to spend more time providing services. We're going to get a more consistent delivery. And so I think the combination of the CalAIM process plus the reprocurement and everything we're going through, 1115B and all those things, when fully implemented and transitioned into, will put us in a better place, in a better position as we move forward. But that alone isn't going to solve it, and that's where as a county we're making massive investments, significant investments year over year. The largest increases are continually across the board in health and human services in our county government, but in particular in our behavioral health program. And I think the combination of all of those things will get us to a better place. And then there's stuff that's not addressed by this that just doesn't make sense, and we're going to have to do the best we can. I mean, the fact that, like, when you go SMI, then you come to us, but only for your behavioral health, but your physical health stays, but then if you go mod, you go back and you bounce. I mean, I'm not even saying who should have it or who shouldn't have it. The structure of it doesn't make any sense. Like, the incentive ought to be to keep you mild to mod, not have you go severe, but if it becomes severe, then it's someone else's problem, but then you're disconnected from your physical health. It goes back to the whole issue. And so I think there's still a lot of structural issues in it. But I think at the end of the day, when we get through the reprocurement and we get through CalAIM and we get through the waivers, we're going to be in a system that will make more sense. It's going to be difficult. It's going to be unsettling. It's anytime you change is hard. I get that. You know, it's not a continuum. It's a pie. Money, rights, lives, dollar amounts, and there's reshuffling, and that creates great anxiety. But I think when it's all said and done, we're going to be in a much better position.
So it seems to me that one of the things that government has proven adept at over the last couple of decades, it is better at contracting out for services and then applying the values of the community as a contract manager in many cases, rather than being the doer of things. Sometimes that's harder for governments to do. San Diego County does a lot of that compared to other counties in California, and does a lot of procurement. It seems to me that one argument could be, and I wonder what you think about this argument, that the county should not operate with multiple plans. This is not for CalAIM, this is at some point in the future. And it should not have its own county operated health plan, but that it should have a competitive process where it procures services from a health plan, and then let the county integrate everything and be the administrative simplifier so that people have more streamlined services. What do you think about that logic?
Well, I mean, look, I've got a little inherent bias that, you know, will probably in large part be very unpopular. I received great health care when I was a Marine for 10 years. Pretty simple system there. I presently get my health care from the VA. I get incredible health care from the VA. I don't know, people complain about the VA. I love the VA. VA is hard to get into, but that's not the VA's fault. That's the process by which it's established to get up. So I see a system there that kind of actually seems to work. And you get good care, and they spend time with you, and the cost, you know, you take the cost we spend for a veteran in the VA, and you look at the cost we spend for a veteran who choices out of the VA and goes to the private market, and that will tell you the VA is actually cheaper. So I kind of think there's a model there that conceivably could work, but we're so far away from that, you know, here in America, it gets hard. But I don't necessarily agree. Look, we've got incredible partners who do incredible work, and we're always going to be dependent as a county on our partners who we contract with and do work, and that's always going to be a significant part of what we do. But there are some instances where contracting things out I don't think is right. I had a huge fight last year with the sheriff, and look, I don't want to fight with the sheriff. I want to get along with the sheriff. Like, I mean, of all the people I don't want to fight with, I don't want to fight with the sheriff. But, you know, the sheriff came in correctional health and said, I'm going to outsource it all to a for-profit, profit-generating entity. And people would say, well, that makes sense because the competitive thing and all that. But it doesn't work in correctional health. Because a lot of times the way you make money in healthcare, not all of you, but sometimes you do more things than maybe you need to do because you're hedging against risk, and that's how you get paid. But in the correctional system, you get a capitated rate per person. So how do you make money there? You do less services. So you deny services because your motive is profit. And the leading entity that was looking to win that contract had gone to their investors and said, lowering recidivism is a threat to our business model. That's not who I want running my jail system. We're trying to lower recidivism. We're trying to invest in that life who comes into jail. We're trying to get them on medication for addiction treatment. We're trying to treat their underlying chronic health care conditions. We're trying to treat their underlying mental health issues. We're trying to connect them to housing and services out so that we don't have a repeat of another economic crime to further their addiction, which just brings them right back to jail. And in that case, I thought, no, I want the jails to be 100% public. Like, we don't privatize the sheriff's department. We don't contract that out because they would only patrol La Jolla because it'd be cheaper. Right? I mean, it's true. And look, I saw the perils of privatization when I was a Marine. I'm a Marine fighting in Iraq, and I got Blackwater folks who are there who are good folks, but the motive is profit. And there are places where the profit motive works and the market work, and I believe in the market, and I believe in competition. And then there's places where it doesn't. Go ask some of these places who say, well, we're going to outsource our water system. Oh, wait. Until all of a sudden you realize the poor folks and low-income communities of color are all drinking polluted water. Why? Because someone figured out how to make more money that way. So we're always going to have partners, and we have wonderful partners in San Diego County. But there are places where it is a public responsibility and a public role, and I'd rather have it done by public workers. And so I think the challenge is assessing how do you best do that. We would never, ever bring 100% of what we do in-house. No one's suggesting that. But I think that there are instances where we have to assess how we do that. And, one thing that we're wrestling with right now is, I believe as a county, we put too many strings and too many barriers on our contracted partners. Meaning we make it too difficult to comply with the terms of the contract, and there's too much stuff piled on top that goes beyond what may be necessary. And we're in a process of actually trying to free up some of those restrictions so that they can spend more of the time and more of the effort delivering services to individuals. So I think it's a balance. I think you got to find, the right thing. But I don't just universally think competitive profit-based systems are inherently always the way to go, particularly when it comes to healthcare. Their role for sure, but I don't think across the board.
I want to get some of your questions. We've got some people with microphones in the back. As you know, raise your hand. I can't necessarily see because of the light, but I'll keep my eye on our team. I want to just say, 2 years ago in 2019, we had this conference, and on this stage was Senator Richard Pan, Dr. Pan, who chaired the Senate Health Committee, and at that conference 2 years ago, people were talking about moving to a two-plan system in San Diego.
It was Sacramento because they're the only other one.
Exactly right.
Yeah.
And so when we have heard people in the last few months say, gosh, where did this two-plan thing come from? You could say, well, if you were at State Reform 2 years ago, you would have heard it. 3, 4, 5 years from now, when people are like, where are all these ideas coming from that fundamentally change San Diego healthcare? I'll say, well, if you were here in 2021, I sort of underscore that as I see we got a question here. I just think these are, whether you agree with these thoughts or not, these are very well thought out ideas. This is a very informed policymaker, so he can hold his own. Question over here?
Hello,
Yes.
Ashley Kirk with Dear Partners. Very excited to be here. And as a San Diego native, thank you for your work as a supervisor here. So one question I have is, at one point, San Diego County had the highest rate of youth and adolescent suicides in the state. And I know you all have done a ton of work in terms of behavioral health hubs and really investing your efforts in behavioral health over the years. Mm-hmm. And with the pandemic really showcasing the disparities among communities and really the need to invest in mental health services, we're seeing things like the Department of Healthcare Services investing in student behavioral health and really creating stakeholder work group sessions to really talk about this and tackle this. But curious to learn a little bit more about what you all are trying to do to really, work on behavioral health amongst the adolescent youth and even adult populations to really control that, just given what's happened with the pandemic and showcasing that.
Yeah. No, thank you for that question. Last night, I had a great honor. We had an entire youth mental health town hall. Just with youth leaders from across San Diego, and it was really designed of like, you all tell us, what do you need? What are you seeing? What are you feeling? What are you experiencing? Like, how do we align our systems to actually listening to the youth that will use them? How do we do them in a way, which is actually something I do all the time between our 5 kids. They go from 10 to 25 on daily, like, hey, would young folks like this? And they're like, nah, boomer. No. I'm like, I'm not a boomer, and they always call me boomer. But I think part of it is listening to them, right, about what they need to do. A second thing is so much of the focus actually has been on, in particular, our SMI, severe mental illness for Medi-Cal lives. That's been our focus, and so much of the focus gets pulled to the crisis level of care and how we get people out of a state of crisis, right? So that individual that's outside the building, you know, who's having a really bad day, I don't want the cop, the fire truck, and the ambulance showing up. So now we spent $25 million. We have mobile crisis response teams that are almost countywide, will be countywide before the end of the year. Clinical, compassion, empathy, they can spend as much time, they get you there. Now we got to have somewhere to go, and that's the network of crisis stabilization units we're opening, right? We don't want you to go into jail. We don't want you to go to the emergency department unless you need to. We don't want you to go in our psych hospital unless you need to. We stabilize you. And then the real core component of that is that person-centered care coordination, right? So you go to that CSU, 24 hours, you get stable. Now, how do we actually give you, and that's what we're in the process of launching, working with a lot of you on, a person-centered care coordination. You get in one individual, almost like a child in foster care gets a social worker. That person will take you. I mean, we think about this. We discharge someone, and we're like, oh, you got a follow-up appointment in Carmel Valley in 10 days. And then we're like, why didn't they show up? Man, how the hell are they going to get to Carmel Valley 10 days later? They don't have a place to live. Well, that person can be your housing navigator. They can take you to get your medication. They can come check on you. They can check on you 3 times a day. Maybe you're doing better, it's 1 time a day. Maybe you're doing better, it's 3 times a week. Maybe once a week. Maybe you start sliding back a little bit, it's back to 3 times a week. Then if you fall into a state of crisis, and we call MCRT is like, oh, your care coordinator, Ashley, hey, come, right? Because we want you to live not in a state of crisis, stable, out on the street, waiting to crisis. We want you to live in that community care coordination. A part of this was, I had an idea a few years ago to launch what we called the Behavioral Health Impact Fund, and it is way too slow in getting implemented, and we're working on that. But the idea behind it was this. So many folks out there are providers, and they provide outpatient services, maybe inpatient residential drug treatment services, and they have a funding stream that covers, or tries to cover, comes close to covering the operations, maybe drug Medi-Cal. But I want you to go from 10 beds to 20 beds. Well, you don't have a funding stream to go from 10 beds to 20 beds. So we took $25 million in a pot and said, show us how you can buy a building, renovate a building, expand a building. And then when you do that, you have a funding stream to cover the ongoing operations, and I'll write you a check. I'll give you the money to do that. Because we've got to build out that level of community care. That stuff that is short of that crisis care. If that's where we want folks to live, we got to build that out. And that's outpatient, it's a variety of things. And then that's where we want you to live. And so everything we're doing is around getting folks, particularly the SMI population, to live in that. But a blind spot was we weren't inherently focusing on everyone else. Right? That's fine for the SMI lives. That's a state of crisis. It's what we see when we drive through downtown. We got to do that. So when we got our ARPA funding, our federal funding, one thing I thought was vitally important, and I pushed hard, was one of the single largest allocations of ARPA funding we did was $30 million to do mental health screenings for every single child in San Diego County Public Schools, to do that screening. Because we know pre-COVID some of the kids were struggling. We know coming out of COVID, they're really struggling. The isolation, not having their friends and their social networks and their recreation and school and all of that. But it's not just enough, and so we're working through that now with the school districts, and because the bifurcated nature of American government is such that in one county you can't have one school district, you got to have like 42 school districts. But we're working through that. It's not 42, it's a lot though. But it's not only important that the screenings be done, and some of this work has been happening, so some we can augment good work that's already being done, some we got to launch it. But let's say we assess, hey, this child is in need, or young person. Well, if they're in the private pay system, it may still take them 6 to 8 weeks to get an appointment. So how do we bridge your services? So we're not waiting 6 to 8 weeks. We can start treating you until your regular provider picks you up. Or if you're in the Medi-Cal system, maybe you're not enrolled. We enroll you, we get you going. It's still going to take 6 to 8 weeks. So it's about the assessment and the immediate connection to services until you get into that ongoing thing. And I honestly think with youth, it's going to be better. I think the younger generation didn't inherit a lot of our stupidity around the stigma associated with these things. And they're going to be more open and more willing to engage in these conversations. And I think, but again, we have to put the resources. So that's one specific thing we did, particularly to help the youth when it comes to mental health.
Can you stick around for a few
Yeah,
minutes
yeah.
for folks to chat with you in the hallway?
Yeah.
Supervisor Nathan Fletcher, Chair of the County Board of Supervisors. Thank you, sir.
Thank you.